Dear students, welcome back. In the previous session, we have discussed about the hip joint articular surfaces, ligaments, and also the blood supply, nerve supply, and the movements which are taking place at the hip joint. In this session, we are going to discuss about some of the important relations of the hip joint. So here in this pic you can see the longitudinal section on the lateral aspect of the hip joint. Here the head of the femur is removed here, and you can see the muscles and some of the structures which are related to the hip joint. So this is the hip joint, the central part, and this hip joint having the relations anteriorly. So anterior relations, posterior relations, and then superior and inferior relations. Here also we can separate this one over this hip joint. This becomes the superior relations, inferior, anterior, and posterior relations. Okay, so now first we will see the anterior relations. So anterior to the joint a bursa is present which is separating the tendon of iliopsoas. So anteriorly the joint is related, first bursa and then the tendon of iliopsoas, and anterior to this it is related to the femoral vein, artery and nerve. These are the anterior relations. Okay, if you see the posterior relations from above downwards we can see. Okay, from above downwards, normally it is having the piriformis muscle. So posteriorly it is related to the piriformis muscle, and the gemellus superior and gemellus inferior. In between you'll have the tendon of obturator internus. Okay, and also the quadratus femoris. And this quadratus femoris is covering the tendon of obturator externus. Okay, and it is also related on posteriorly by another nerve called sciatic nerve, and also the gluteus maximus muscle. These are the relations. One is piriformis muscle, okay, and gemelli, piriformis and the gemelli, superior gemelli, inferior gemelli. In between you'll have the tendon of obturator internus and then the quadratus femoris muscle, and for all these muscles behind we'll have the sciatic nerve, and behind the sciatic nerve we can see this big muscle, that is gluteus maximus. These are the posterior relations of the hip joint. So we have finished the anterior relations and the posterior relations. Now coming to the superior relations. Okay, superior relations, which is having the rectus femoris muscle. Okay, superiorly it is related to the reflected head of rectus femoris and partly by the gluteus minimus, mainly by the gluteus minimus and gluteus medius, and partly by the gluteus maximus muscle. So these are the superior relations. What are those? One is the reflected head of the rectus femoris, and then gluteus minimus, gluteus medius, and then partly by the gluteus maximus muscle. Now we'll see the inferior relations. Inferiorly we can see the pectineus muscle. Inferiorly we can find the pectineus and obturator externus. Okay, obturator pectineus obturator externus. This one is obturator externus, pectineus, obturator externus, and also in addition to these muscles, it is related to the gracilis. Okay, here you can find the gracilis and then the adductor group of muscles. So here you can find these adductors. So adductor longus, brevis and adductor magnus muscles. And also hamstrings inferiorly. You can this one is related to the hamstring muscle. So if you observe the hip joint, the ischial tuberosity which is present below this acetabulum. So the muscles which are originating from the ischial tuberosity or the hamstring muscles. So and these muscles are related inferior to this hip joint. And also if you can see, if you observe that the placement of these muscles, okay, so the muscles which are related anterior to the hip joint are mainly helps in flexion and medial rotation. Okay, the muscles which are present on the posterior aspect, they help in extension. So the muscles which are placed on the superior aspect, they help in abduction. Okay, they help in abduction. They act as abductors. If you see the inferior muscles, they help in adduction. So the abductors they help in lateral rotation muscles. Okay, so these are all about the relations of the hip joint. Thank you.